My name is Elizabeth Nguyen, and for my health behavior journal, I chose the topic to increase cardiovascular health behaviors. The significance of this health behavior includes these benefits, which are lowering blood pressure, decreasing the risk of heart disease, stroke, and diabetes, reducing your body weight, as well as bad cholesterol, also known as your LDL, and increasing good cholesterol, also known as your HDL. This also reduces chronic pain and asthma symptoms. According to Healthline, it is recommended to do 30 minutes of moderate intensity cardio activity at least 5 days per week, which equals 150 minutes per week, and also 25 minutes of vigorous aerobic activity 3 days per week, which equals 75 minutes per week. And this is the baseline description of this health behavior change.
I used to exercise 6 times a week, but once school started getting harder, I stopped going. And when I told myself that I would start going to the gym again, I no longer felt that motivation to go. I would go for a day or two and then stop going until a few weeks later. Going to the gym and exercising was no longer a part of my everyday routine, so I no longer felt that push to go nor felt motivated. I began gaining weight and running out of breath really fast. I wanted to focus on increasing my cardiovascular system to help me become motivated again and make this a part of my everyday routine so that I can feel healthier and stronger.
For my 3 interventions, I chose to consume healthier foods such as fruits, vegetables, whole grains, low fat dairy, lean meat, and fatty fish rather than red meats and processed foods. My second intervention I chose was to swim twice a week as well as do resistance training on the other days so that I was getting my cardio in but also my resistance training. For my third intervention, I chose to cut back on sugary foods and drinks. For the progress of health behavior change, for week 1, I wanted to meal prep for the whole week on Sunday and try to hit the gym at least 3 days out of the week. For week 2, I again wanted to meal prep for the whole week on Sunday and try to hit the gym at least 5 days out of the week. For week 3, I wanted to meal prep for the whole week on Sunday again, and this time try to hit the gym at least 6 days out of the week. And for week 4, I wanted to be able to make this my everyday routine. So then I would meal prep for the whole week on Sunday and hit the gym all 7 days of the week. And these were my successes.
I began feeling less tired throughout the day and I had more energy than I did before. I also felt more fit and I wasn't running out of breath as easily as I was before. And lastly, I also woke up with less bloating and I also had less bloating throughout the whole day.
And these were my challenges.
Like I previously said, feeling motivated to go to the gym every single day was hard, as well as cooking for the whole week on Sundays. Meal prepping was not something that I liked, but I tried anyways because I knew it would be better for me to eat healthier. And also, a challenge was not having enough time to go to the gym due to school and work.
So this table here shows what actually happened in those 4 weeks. So for week 1, I did meal prep on Sunday and I went to the gym on Monday, Wednesday, and Thursday. So I did go to the gym at least 3 times that week. For week 2, I meal prepped on Sundays again and I went to the gym Monday, Tuesday, Wednesday, Thursday, and Friday. So for that week, I went 5 times out of the week. For week 3, I started feeling lazy, and so I did not meal prep for the whole week, but I did go to the gym on Sunday to make up for it, and I also went to the gym Monday, Tuesday, Wednesday, Thursday, and Friday, so I ended up going to the gym 6 days out of the week. And for week 4, going to the gym started feeling easier, so I did go every single day that week, as well as meal prep on Sunday for the whole week. And these were the theories and models that I chose. So I chose the health belief model, and the construct that I chose was cues to action, which is the stimulus needed to trigger the decision-making process to accept a recommended health action. So I knew that I wanted to become an EMT, and for this, I knew that the interview process, you would need to do a physical to show that you are strong enough to be able to lift up a patient, such as in this picture, where you and your partner will both have to be able to carry a certain amount of weight and lift up that patient. So I wanted to become stronger and be able to pass this physical so that I would actually be able to work as an EMT. And that was what motivated me to perform this action. I also chose a theory of planned behavior. For this, the construct I chose was behavioral intention, which is the motivational factors that influence a given behavior, where the stronger the intention to perform the behavior, the more likely the behavior will be performed. So, like I said, my motivational factor was being able to lift up a patient, and patients are varying, so you never know how heavy the patient you pick up will be. And so I wanted to be able to increase my strength to be able to lift up patients that are on the heavier side without hurting myself, hurting my patient, or also hurting my partner. And I also chose a trans theoretical model. And for this construct, I chose the action stage. This is when people have recently changed their behavior and intend to keep moving forward with that behavior change. So I specifically chose increasing cardiovascular health because I wanted to become healthier overall, but also become stronger and also run out of breath easily, or not so easily. I wanted this to motivate me to get back on track and make this an everyday thing where I would go to the gym every day, become stronger so that I would continue getting stronger throughout this whole job. And these are my recommendations.
My recommendation for people that want to increase their cardiovascular health is to start small and build up. It's not a race or a competition. We all start somewhere, and it is better to learn proper forms and techniques before diving straight into the advanced exercises. If you know you're not motivated to go to the gym or just exercise in general, find a gym buddy so that you guys can both motivate each other.
And this is my health behavior journal on increasing cardiovascular health behaviors.